Hi, this is Dr. Altamirano. For most of you, Dr. A. I know my last name is not that easy to pronounce. So today I'm going to do a live broadcast, a video on my personal Facebook, because I normally do this every week on my support group. And actually, I decided to do this video to explain what an iron sleeve is. And the thing is that a lot of people ask me if there's any difference between a regular sleeve gastrectomy and an iron sleeve. And actually, there is not really. I'm going to explain that in a minute. And the reason I'm explaining this is because this concept, it's much more than just getting a surgery. The surgery itself, the sleeve gastrectomy, it's a really powerful tool, but it's just a tool, and it's not a magic pill or a magic bullet, as we call them. It's a tool, and you need to learn how to use it in order to be successful. So the story goes like this. A couple of years ago, don't remember if it was like 3 or 4 years ago probably, my patients started to see some differences between their progress and other people's progresses, and in different groups. They started to tell me that the complication rate, secondary effects were a little different, were less in our group, that hair loss, breather nails, dry skin, infections like UTIs, esophageal cyst, and other conditions were not seen in my group. And they start asking why. They start asking me if there is any differences in the technique. But no, actually, no. Well, probably. I'm gonna get there in a minute, but not really. So Danielle and Edna Ortega, Nita and Danielle, hello, how are you doing, girls? And starting to call them iron sleeves. They were like, oh, that's because our sleeve is an iron sleeve. We don't have these kind of conditions and problems and infections because our surgery is perfect and stuff like that. And I was like, okay, let me think about it for a minute, because even though the technique is clean and it's something we do every day, we have done thousands of times, and you can even watch a full sleeve gastrectomy on my website and under 10 minutes, because this is what we do every single day, and it's clean, and it's the technique is standardized. So I know there are other good doctors doing really good jobs and good surgeries, so I don't think that's the real thing or the real difference between a sleeve and an iron sleeve. So started to evaluate the situation and the comments, and I was like, okay, there is really a difference. I go to several groups and you see lots of people posting their chunks of hair coming off, and lots of hair loss, lots of infections, people that looks gray and pale and losing a lot of weight. And so I was starting to analyze what was happening and what was the real difference between my sleeves and the iron sleeves and regular sleeves. And I believe that part of it is misinformation and ignorance about this topic. Don't get me wrong, I know how social media works. I'm not calling anyone ignorant, okay? I know there's a lot of knowledgeable people out there, and nurses and people having the surgery, but sometimes people don't know about the topic, and even doctors sometimes don't really know about this topic because they don't go to congresses and try to be up to date with all the discoveries about hormones and physiological changes with this surgery. And some people are stagnant there in the old ancient idea of restriction, malabsorption, and portion control. They sell the idea to the people that by making their stomachs smaller, they will eat less, and that's why they will lose a lot of weight, and that's not true. I always explain in every and each video consultation that this is a metabolic surgery that fixes a metabolic error, a leptin resistance. We reprogram your metabolism, that we call that your set point. We reprogram it to a point where your brain will detect you actually have an excess of energy. It's going to make you lose a lot of weight, but once you get there to your new set point, it's going to be up to you to keep it that way. And that's where the main difference comes. We started the support group, the Dr. Altamirano's Iron Sleevers support group, as an extra tool to fight an addiction. So let me switch from the medical perspective to the therapist perspective, because from the medical standpoint, the point of view, is the same. All doctors will do the same surgeries, pretty similar techniques, some differences in the calibration and the decisions they make, the kind or size of staples they choose, but that doesn't make a huge difference. The technique is pretty standard around the world, not perfectly standardized. Some people will do it this way or that way, minor differences. The results are normally good with any other doctors. All surgeons are doing a good job. But what comes after that is the real problem, the therapy. I always explain my patients, my family members, as we call them, that this is a treatment. Just getting the surgery is not enough. We have emotional eaters, stress eaters, and I like my patients to get advice, tips, and tricks and recipes from people who actually understand their struggles before and after surgery. So we started the support group as a group therapy to fight an addiction. Food addiction is real. I understand that most people won't recognize the problem at first. They just want to lose weight. They just want to look fantastic, and that's it. I want to have the surgery because I want to. I have a wedding in 3 months, and I want to lose 40 pounds, 50 pounds, and whatever. They have their own reasons. But just losing weight is not all of it. Keeping the weight off is actually the challenge. The maintenance part is the difficult part. So we started the group, and we started talking a lot about this problem, addictions. People start talk about their own struggles and how the family dynamic is so important, because I get this all the time. Oh, my whole family is big, and that's why, it's genetics. That's why I'm that big. And I'm always like, no, it's not genetics. Most probably your whole family eats the same way. So, your education, it's the same. You have to finish your plate. You can't leave the table. You have to repeat, and that's the problem. We have to celebrate with food. We have to mourn our dead with food. We have, everywhere you go, there is food, and normally not the healthy kind. So you never learn how to eat healthy and how to choose wisely. And even though you think you do, you don't. I mean, most people believe they eat pretty healthy because they eat fruit and veggies. Yeah, but what kind of fruit, what kind of veggies, and what portions? Because if you tell me you eat a lot of fruit, but that's like, a fruit salad with lots of bananas and watermelon, and then you add some cottage cheese because it's super healthy, plus some granola and honey because all of it's healthy. Well, that's kind of the problem. Part of the problem is that you eat what you think is healthy, but it's not really. I call all these kind of foods like protein cupcakes and pancakes, all these puddings, chocolate pudding with whatever you do. I call them healthy junk food, because at the end of the day, you keep searching for these kind of flavors, this kind of junk food, but with justifying the caloric and nutritional content. But you are not really eating healthy, like just regular raw veggies and some fruit and chicken and lean protein like egg whites and all that kind of stuff. So I call them healthy junk food. You try to justify the caloric and nutritional contents. But we started the group because we were trying to find a way to fight this addiction as a family. I tried to call all of my patients that were having the same day surgery the same day, slave sisters and brothers. I tried to make them realize you have to sponsor your sisters and they will be your sponsors on this journey. I tried to talk to their families and tell them they are part of this process too. To the husbands, I tell them, you have to watch her. You need to follow the diet with her. You need to help her out, because if she has to eat healthy every single day, but you're still bringing cookies and chips and all this kind of junk food to the house, even your children will keep eating that kind of unhealthy food. And also, we are losing this fight miserably. We have all these huge companies like Walmart, Starbucks, McDonald's and you name it, selling really cheap junk food. And let me say this once more, really cheap junk food. Because at some point people started to believe that healthy habits and eating is expensive. You know, eating healthy is expensive. And I'm like, are you sure? I believe that junk food is too cheap. And that was the main purpose of doing junk food and fast food. To make it cheap, affordable, and sell a lot of it to make a lot of money. So actually this started to make it cheaper. Doesn't mean that healthy food become more expensive. Not necessarily, sometimes, but I mean, not really. So in several groups, you see a lot of doctors, a lot of people, even associations, bariatric associations around the world. And I know I will probably be crucified by this, but I think I have the enough people and experience and stuff to and lots of books. It's not what I think. I think we have lots of books proving that there is certain amount of calories your body will need to survive and be healthy. And 500 calories is not the magic number for sure. You can go to ICU books, general surgery nutritional books for patients that have severe problems and diseases and sepsis and all that kind of stuff. And they teach us during the surgical residency that you need to have a baseline for survival that could be 500 calories in Mexico, but it's about 800 calories in the States, according to several books, including the U.S. Coast Guard. I have to talk about that in my group. You need 800 calories to survive, to breathe, and your heart to beat. So basically, just for survival, you need 800 calories, okay? From there, you will be probably talking, thinking, walking, and doing other stuff through the day. So you definitely need more than that. So I started to educate my patients to eat at least to get to 900 calories as soon as possible, pause-up, and then 1,200 calories, and that's our baseline for a regular day, for a regular person that on an average weight, you know, it's difficult for someone to need less than 1,200 calories, you know, just in any time or any moment, any given moment. So if you start exercising, you will need more calories. So at the end of the day, what I try to teach my patients is to give the body what the body needs. No less and no more. My pre-op diet is a little different. I don't do clear liquids for 3 weeks like some doctors before surgery, because I know for a fact, it's not just my belief, that starving your body right before major trauma is a bad idea, because you will need the nutrients for the healing process. You will need protein and good quality amino acids for your stomach to heal, for, you know, blood clots and you know, to stop bleedings and whatever. So ignorance and misinformation about how the surgery works, because it's not restriction, it's a metabolic surgery. And to prove it's a metabolic surgery, we have lots of examples. People getting the surgery will improve their diabetes and high blood pressure in less than a week. I have patients using 250, or the record is up to 430 units of insulin a day, using no insulin in less than a week. That's because this is a metabolic surgery that increases incretins, GLP-1, you can Google it, that's one of the most studied incretins. Destroys insulin resistance, so you don't need a lot of insulin anymore, sometimes not at all, for years to come. I'm not saying you cure diabetes, but you improve it a lot. You get it under control for years. So you start teaching this to people, and you start making them realize they are doing something more than just restricting how much they can eat. And the reason you have to insist on this a lot is because the people, they feel they can eat more, they will, if you don't teach them how to eat healthy. You see this in several groups all the time. Oh no, I can eat more than right after surgery. I had my surgery 3 years ago, and now I can eat almost a normal plate. And I can eat more. And I'm always like, well, you can, but doesn't mean you have to. So if you don't understand that at some point you will be able to eat more because your sleeve is going to stretch a little bit, I mean, you do an endoscopy 3 years post-op, and you will see that sleeve has stretched a little bit. Because the stomach is made by muscle, and muscle is elastic, and it's going to stretch eventually. But the same happens with the bypass, the pouch is going to stretch, the intestinal vagosity are going to overgrow to compensate the malabsorption, and it's going to increase the surface of absorption. The body is awesome. The body will adapt. But that's not even the problem. Also, the gastric emptying is going to be faster, so you accelerate the gastric emptying. So, of course, you can eat more, but doesn't mean you have to. If you are not prepared for that time, when the time comes, you need to make sure that you can do the proper choices of food and the proper sizes. So it's a training. Restriction is real. It's a real thing. I mean, it's true. It's kind of a secondary effect of cutting out 80% of your stomach. So you will have restriction. And it's convenient because if you eat too much, too fast, or you didn't chew a lot, you're going to regret it because it's going to hurt or you're going to throw up. So yeah, there is a lot of restriction. It's part of the process. It's a good tool, training tool if you want to call it that, but it's not the goal. It's not the ultimate goal. It's not the main mechanism. So don't rely on restriction. So start to analyze all these situations in different groups, and I wasn't sure what was the huge difference, but I identified several differences. That come, including the pre-op treatments, the pre-op hydration. We give at least half a gallon of IV fluids to all of our patients before we start the surgery, and that decreases all the nausea post-op, that decreases a lot of the symptoms, and decreases the risk of having blood clots. I mean, definitely hydrating the patient is a good idea. Second, I don't do the clear liquids diet. You eat high-quality protein shakes, chicken salads before surgery. You can have your last meal at midnight. You drink a lot of fluids until 9 a.m. We start surgeries at 4 p.m. So by that time, you already had 2 more liters of IV fluids. So hydration is important. When they start talking about hair loss, breathing nails, and urinary tract infections, UTIs, and other esophageal yeast and stuff, I'm like, okay, what is happening in those patients and those groups is that they have no follow-up. People are scared to death. They are afraid of gaining weight back. So they start malnourishing themselves. They are starving, literally. They follow this 300, 400, 500 calories a day regime for months. I've seen some charts recommending 500 calories for 6 months. And their argument is that there is not such thing as an starvation mode on a patient that is not starving, because your patients are obese. They have a lot of fat and a lot of calories in their bodies. And I'm like, you don't even understand what you're talking about. It's not about real or not, or unreal or fictional starvation. Your body believes you are starving because you are not getting the calories your body thinks you need. That's it. So your body starts releasing stress hormones. And if you release all this cortisol and ACTH, adrenaline, and all these hormones, your immune system will get tired at some point, and your immune system will be weak, and you will start getting infections. Like yeast infections. I mean, esophageal yeast just happens when your immune system is compromised, and it's not uncommon. So definitely the post-op care, it's a problem in most groups or companies or whatever. So that's why on my Iron Livers program, I request blood work every 3 months. You need to check how the immune system is working, if you have enough iron and electrolytes and vitamins, and how your thyroid is working, if your A1C is going down because you were diabetic and we need to get that under control, you have PCOS, whatever. We need to monitor all of it, and we need to make corrections on the flight. I mean, if you're having vitamin D deficiencies, we need to correct them. If you have anemia, your tissues won't have enough oxygen, and you will feel tired all the time. You won't be able to exercise. So you definitely need to do a medical follow-up. And why not? It is a medical procedure. It is a major surgery. And I don't understand why people are getting the surgery and then no follow-up at all. And most importantly, you are having surgery in Mexico. So your doctors probably won't even know you had the surgery, or they won't be willing to help you. So we need to find a doctor that will be able to order the blood work, and it's doable. I do that every single day. I check blood works every day. So it is doable, and I think is the correct thing to do. So when people start talking about delay leaks, for example, 3 weeks post-op, 4 weeks post-op, how is that possible? Well, we cut out 80% of your stomach. That means the mucosa of the stomach will be torn and exposed to the acid. Basically, you have a really long ulcer. You need to give the patient the proper treatment to control that ulcer. And by correct treatment, I mean more than just omeprazole and Gaviscon, because that's definitely a really important part of the treatment. But also a good nutrition, because how do you expect your stomach to heal if it doesn't have the nutrients and the proteins? So malnutrition is definitely the main reason for delay leaks. Malnutrition before surgery and after surgery. Just consider this. Even though our patients are suffering from obesity, they are malnourished because they don't get the proper quality or amount of nutrients. They are not eating the high quality protein they are supposed to. They are eating fried stuff and sugars and lots of stuff. So inflammatory response is increased. Actually, obesity is a chronic inflammatory state. So just by following the pre-op diet I recommend, that is not clear liquids, it's not starving people. It's high quality protein shakes that are not that good, but egg whites, chicken breast, turkey, fish, tuna, and veggies, salad, especially green leaves, to increase a lot of the fiber and stuff that people normally don't get in the regular diets. So you start that pre-op diet, and my patients are losing an average of 20 pounds in 2 weeks before surgery. And you might think, well, that's great, that probably diet will do the trick. Well, not really, because you are not fixing the metabolic problem. You are not reprogramming the set point. So the problem has never been if they are or not able to lose weight, because most of them have lost weight in the past. But it's almost impossible to keep the weight off. So definitely the surgery will fix that. So, malnutrition, and it's the main reason why people have delayed leaks. Dehydration is the main reason why people will have blood clots post-op. So after analyzing all of this, I was like, you know what? An iron sliver is not a thing. It's a process. It's a protocol. It's a therapy. From the medical point of view, we try to give proper nutrition before surgery so they can have a good outcome. Then during surgery, you give them a proper amount of fluids. During and post-op, of course, you keep the hydration as high as possible. You have a good pain management and nausea management protocols. And then they resume their treatments and their diets as soon as they can. We give them a 30 days worth of menus. So you have day 1, 2, 3, 4 for 30 days. You can extend that for 2 or 3 months. But at the end of the day, we try to fast track the diet until they get all their nutrients. Remember, your body doesn't care if you have 3 jobs or 10 children. If you don't give your body what your body needs, it's going to get sick. And that's my main concern. After surgery, I try to push my patients to get their nutrients as soon as possible to prevent infection, hair loss, and delay leaks, and everything like that. So, another huge problem I see, and one of the reasons why I believe that the group is working so well. And don't get me wrong, I'm not trying to sell you the group at all, because that group is actually just for my patients. And that's kind of a problem sometimes, because I get requests every day from different people that want to join the group and learn the program, watch the live shows every Saturday and stuff. And I'm like, you know what, I have a fan page. I mean, if you need information, I can offer you a free consultation over video, and you can be part of the program. But most of them already had surgery, and they want to join the group because they have no support, no follow-up. They are not able to talk to their doctors ever again, so they don't have a follow-up at all. So they are in the dark completely. So another problem is they won't find unifying criteria in different groups, because you go to a group with 50,000 people and you will find 2,000 doctors that did their surgeries. And, oh, my doctor told me this, my doctor told me that. Oh, my doctor recommends a diet to reset your pouch if you're not having restriction. And I'm completely, let me be clear, I'm completely against the resetting your pouch diet. And let me stop for a minute and explain why. Because your sleeve is not a device where you can just push a button and you're gonna reset it to fabric, settings and stuff. No, it's not like that. You can't reset your pouch. That doesn't exist. What most people are doing, they go back to clear liquids for a week or two. What do you think that's gonna cause to your sleeve? Of course, it's gonna cause gastritis, because you are not eating. So your sleeve is gonna get swollen. You're gonna cause inflammation. So you will regain your restriction, but you're actually hurting yourself. And you are starving, and the moment you start eating something, your body's gonna absorb it as a sponge, because you were starving for some time, for a couple of weeks. So let me tell you something. These people trying to reset their pouch, I cannot guarantee this, but I'm pretty sure that 99.999% of the time feels guilty. They are ashamed that they are not following a proper nutrition, they are not exercising at all, and they are not planning to. They just want the surgery to keep working and do the work. And they are like, oh, my sleeve is not working and I'm gaining weight back. And I'm like, well, you are not working. The sleeve is well, but you are not working. You are not using your tool, you are not exercising, and you are not eating healthy. So resetting the pouch, not a real thing. I know people will hate me for these comments, but it is what it is. And that's what I recommend my iron sleevers, and I think it's working well. I'm always like, okay, you know what? You screw it up. You feel guilty. Next day, you go back on track, hit the gym, go back to your nutrition. That's all you can do. That's all you can do. No, don't do this crazy stuff and starve your body. And fasting could be healthy, but there are some different motives and reasons and times and ways of fasting. So that's a different thing. But going back to the pre-op diet, clear liquids for 2 weeks, that's not really fasting, and most people won't choose the best quality clear liquids either. Like they will choose Crystal Light or whatever, sugar-free, but with sweeteners kind of fluids. And sweeteners are not good for your metabolism either. So the other problem I find is no unified criteria in different groups, so it's difficult to really direct people in the right direction. And there are some, of course, there are some difference in the technique, and you can watch again. You can watch how I do things on my website. But at the end of the day, I believe that creating the consciousness as a group and as individuals, that this is something you can control, that this is an addiction that you need to fight every single day and you cannot cure. It's a big part of the healing process. You need to heal, you need to forgive yourself, and I have mentioned this before. It is your fault to be where you are. You have been eating unhealthy, you have been basically punishing your body for years with eating poisonous foods, and you know that. So it is your fault. You have been doing stuff you shouldn't, but it's not your fault not being able to lose weight. And it's difficult to understand, because even doctors tend to judge my patients, telling them, you know what, you just need to eat less, just follow a diet, just exercise. Oh wow, thank you, it's that simple. But it's not really. You have something called leptin resistance. That means, your fat produces leptin. Leptin tells the brain how much energy you have stored. If your brain, your set point, is resistant to leptin, you will need a lot of fat to make your brain believe you have this amount of leptin. and that's when everything starts snowballing. People with BMIs of 50 start getting, gaining weight like crazy, and they get to 60 really easily. And I always compare this with diabetes. A patient with diabetes starts with insulin resistance. Then your pancreas crashes and can't produce enough insulin. But the real problem is that your body don't registers the insulin. You are resistant to insulin. You can't use it, even if you have a lot. So what you need to do is to make your body more sensitive to insulin, right? But if you go to a consult with a doctor and you tell your doctor, I'm a diabetic patient, and your doctor tells you, oh, you just need to become more sensitive to insulin. That's not a real thing. I mean, that's okay. What do you want me to do? Are you crazy or what? I mean, I cannot just decide to be more sensitive to insulin. And the same happens with obesity. Okay, you can eat less, but you're still resistant to leptin, so that you're not fixing the whole thing. I mean, you can lose weight. I have people losing 50 pounds several times. They have lost probably 500 pounds for their whole lives, but they gain it back like that. Because again, you have your set point here, you lose some weight by yourself with diet or exercise without changing the set point. Your brain detects you don't have enough energy. On the contrary, your brain thinks you are sick, stressed, starving, something's wrong, you're dying, you don't have enough energy, and it's going to fight back to me. You get all the way back to normal levels, and that's what we call the rebound or yo-yo diet. So weight loss surgery is a tool that is going to destroy your insulin resistance and your leptin resistance. It is a treatment, a medical treatment. So people just telling you need to eat less are not really knowledgeable of this topic. And the therapy should be directed towards addictions. We have talked about this a lot in the group. We even have some recovered drug addicts sharing their experiences and giving testimonies. I even did an interview in one of them. Hello, Billy. He's really famous and popular in the group. He has lost 300 pounds with the sleeve gastrectomy, by the way. And he even asked me to share his story at some point and talk about how his life 2 years post-op. And it was an awesome interview that you can always find in our support group. You just go to the search box and you type live broadcast and you will find it. So at the end of the day, what I believe, let's wrap it out. We need, I think I've been talking about for about 30 plus minutes, so I need to try to focus on what an iron sleever is. So at the end of the day, when Danielle and Edna started to call them iron sleeves, we're having an iron sleeve. It's not just a regular sleeve, it's an iron sleeve. I was like, oh, that's catchy. But at the same time, I think that there's something there that is different from other groups. And I try to compare it with, let's compare it with cars. You can get your car with this retailer or this one. And this one, it's $100 or $200 cheaper. But this one that is $200 more expensive includes the services for a year, 2, 3 years. So you come back 3 years later to give your service to your car, and your car is running well and fine and perfect, and it's working. It's just working, just works. That's it. It's working. And you're happy with your car because it works, takes you everywhere. You can do whatever you want. And the other guy that never gave the service because he didn't want to pay services, he wanted to save $100 or $200, now has a car that doesn't work at all. And it's not going to take you anywhere. So he went back to square one where he didn't have a car at all. So I think it's a pretty close comparison. If you get your surgery and then disappear and you don't have support, you don't have a medical follow-up, if you don't find a nutritionist, if you don't check your blood work, then you're going to get in trouble. And even more important, when you get the bypass. I'm going to stop for a minute there because I think it's important, because it's called iron sleevers, but we also do bypasses. The thing with the bypass is you will definitely, for sure, have malabsorption. And I'm not even concerned about malnutrition really, because my patients are getting their supplements and eating healthy, and I have a proper follow-up with them. But my main concern is what happens when they get dehydrated or they are just not absorbing potassium properly. They are not drinking enough potassium. They are not monitoring their potassium or calcium. Well, last year I saw 2 ladies from other groups that had surgeries, and not in Mexico. Okay, that's it. It's not, doesn't matter where they had the surgeries, because I think the problem wasn't related to the procedure technique, or it wasn't the surgery itself. These 2 ladies died. Well, actually, they were 3. One of them was one of my patient's sister. And let me start with her. My patient was having the surgery in 4 days, and she called me to cancel because her sister passed just suddenly, and she was in ICU, and they weren't sure what happened. And she told me, but you know, my sister that had the gastric bypass here in the States years ago just vanished. You know, like she just passed out, blackout completely for some reason. And now she is in ICU, and doctors doesn't know what happened. And I was like, can you please ask them to check her potassium and calcium levels? And she had 1.3. 1.3 is like ultra, mega, super low. It shouldn't be compatible with life. And what I think is she had a syncope. She just, you know, a heart arrhythmia, severe heart arrhythmia, low oxygen levels in the brain. She passed out, and sadly, she didn't make it. And a couple of weeks later, 2 more stories like that happened. In different groups. I saw this in other group, and I asked this, it was also the sister posting this. Like, she was like, please don't do the surgeries. My sister just died with this and that. And I was like, can you please check if she had any issues with her electrolytes? And she did. That's the second time we identified the real problem there. So the thing is, if you don't monitor this, you don't, and these ladies had their surgeries 10 years ago. So again, this is not a joke. We are not playing here. It is surgery. It needs a follow-up, a medical follow-up. And you need to monitor the electrolytes and other stuff. I request lots of studies just to, at first, every 3 months. It could be every 4 months, but don't tell people that, okay? I prefer every 3 months. And after the first year, it could be twice a year, or it depends on everybody's needs. You know, if you are still anemic, we need to monitor that, whatever. So that way we can definitely boost the outcomes and improve the outcomes completely, okay? So an iris liver is a therapy where we have the support group because we're fighting an addiction. We have the medical follow-up. And we have, of course, you know, the live shows every Saturday. It's like going to classes. It's like AA, you know, Alcoholics Anonymous. I mean, we need to compare it with that. And please don't feel that like I'm trying to you know, to insult you, because it's not an insult. It's a real addiction. So you need to come to your meetings. You need to learn, and you need to ask. You have the classes, you have the manual, you have the group, and you have my inbox. If you have questions, you just need to ask. Some questions are better answered by patients, so you can ask in the group because they have real experiences, real struggles. They can give you their point of view. But basically, this is a therapy. It's getting the surgery plus the whole system. Support group, classes, and medical follow-up. If you don't get all of that, you can get in trouble eventually. And not everything is related to your weight loss. Of course, better outcomes will come with better follow-up, but also medical conditions can happen there. Okay? So, the classes are live fits, by the way, so you can ask questions in real time. Like right now, I see the comments. So at the end of the day, you can always find a lot of useful information, even if you're not my patients and you didn't have surgeries. I try to do some public stuff like today. I'm going to share this on my YouTube channel. I'm going to share this everywhere I can. because I think it's important for people to know that they need everything else, not the whole package, not just a surgery and stuff. I mean, you can get a cheap surgery in Mexico and then get a follow-up in the States. I mean, but you definitely need to invest in the service of your car. Remember, you get a cheap car without services, it's not gonna work in a year or two. You get your car with all the services, you can use that car for 10 years with no problems, okay? And some of that, what I believe is useful information, it's on my website and it's public. You can always look here. You just come to my website, FAQs, frequent asked questions. Understanding obesity. I talk about all the hormonal changes, metabolic changes, before and after surgery. Calibrating the sleeve gastrectomy. Okay, lots of people want to know how we do it and why it's not smaller or bigger. There is a small, short description here, but basically you can watch me talking about it with, it's not even gross, okay? I use some, drawings and pictures, and you don't have to watch it, but if you want to, you can do it because I have a full surgery. I talk about revision surgery. That's a really good topic most of the times. And also female hormones. That's a huge, important topic, especially for young ladies, because this is going to help them to be able to get pregnant, and PCOS, lots of things are going to be treated with this. Lab and to sleeve revision, mini gastric bypass, and other stuff. You can watch me doing a full sleeve gastrectomy here. This is more graphic, so be careful, okay? Proceed with caution. And also, of course, you can definitely join the support group. That is the Iron Sleevers support group here. Dr. Altamirano's Iron Sleevers. You go to the search box and you type, for example, live broadcast. Remember, go to the magnifying lens here, the searching box. You will find all the previous podcasts, sometimes with a special topic of the day, like sleeve to mini gastric bypass revision surgery. Different topics. Sometimes we talk about quality of life improvement, gallbladder surgery, after that, and I request questions every Friday. Do a list of questions for the live broadcast. So that's also really useful. And it's, I try to make it as easy to find as possible. It is sure a private group. It's not secret because that way nobody will be able to watch it. But it's private group. So whatever you post in there, it's private. Your family or friends won't see it. Okay, don't worry about it. And in order to join the group, you need to be my patient. Okay, that's in the group's description. So I apologize. I understand there are other people that needs more information and stuff, but I'm not able to do all of my patients plus other doctors' patients follow up. You know what I mean? So it's really difficult. I already did thousands of these surgeries. And you can see it just by joining the group because we have thousands of people in the group. Because that's another thing. Lots of doctors will tell you they have done thousands of patients, thousands of surgeries, but they started a year or two ago. Some of them were my assistants, and now they are 3,000 patients, and stuff. Well, where are your 3,000 patients? Can I talk to them? So that's another thing. Choose wisely, do your research. I will be here for you, anything you need, and hopefully this is gonna get to more people, not just my patients, because I think it's some general information that could be useful for some people in order to understand what they are getting into. Because most of the time, they don't really know what they are getting into. They think it's about restriction and that's it. They haven't even considered the magnitude of the problem and the addiction part and stuff like that. So please just let me know if I just have basically one more question for you. Are you looking for a sleeve gastrectomy or are you looking for an iron sleeve? Okay, have a wonderful day, family. See you later. I will keep you posted. We have 4 more surgeries today. And yes, we do Saturdays. We're trying not to, but we still do surgeries on Saturdays. I will see you next week, family, and hopefully this is going to help a lot of people. Please share and subscribe to my YouTube channel, and share my fan page. I'm going to post this on my fan page so it could be more public. Even if you are not my friends on Facebook, you will be able to watch it. Bye-bye. Love you all.